Here is our video on setting up a Foley catheter tray. We will start by looking at the patient Miss P's chart. She has a new order from her healthcare provider. The order is for a short-term indwelling catheter to be inserted preoperatively. Miss P's medical history has been reviewed and there is no mention of prior catheterization or urethral structure impairments that could hinder the procedure. Miss P's allergies are also checked. She does not have any allergies listed. Any allergies to latex or rubber products, antiseptic solutions, and water-based lubricants should be noted prior to catheterization. The nurse enters the patient's room and closes the curtain for patient privacy. The nurse introduces herself and hand hygiene is performed. The patient's ID band is checked by the nurse and the patient is asked to state her name and date of birth. The correct patient has been identified. The nurse begins to explain the procedure to the patient. Miss P, your healthcare provider has ordered a 10 to 12 French catheter with a 5 ml balloon to be inserted before you go in for your procedure. The catheter will be inserted through your urethra into your bladder to allow urine to drain out into a drainage bag. This process is done using sterile technique to prevent any urinary tract infections. Miss P is asked how she feels about the procedure and if she has any questions. She states that she understands and is okay to continue. The following supplies are gathered by the nurse: an indwelling catheterization kit, which includes sterile gloves, catheter, waterproof drapes, lubricant, cleansing solution with an applicator, a pre-filled syringe with sterile water for balloon inflation, and a waste bag for a trash can to be placed near the patient. The nurse will also grab additional bath blankets to drape over the patient. The nurse begins the procedure by performing hand hygiene and applying clean gloves. She then raises the bed to an appropriate working height. The nurse palpates over the symphysis pubis to determine bladder fullness. The patient is then asked to be in a dorsal recombinant position, laying on her back with her knees bent and thighs relaxed. Drapes are placed to only expose the perineal area of the patient and protect patient privacy. Neonatal care is conducted and the patient is examined to identify the urinary mucus. The nurse then discards her gloves and performs hand hygiene. The catheterization kit is placed on a clean bedside table and opened using sterile technique. The square drape is unfolded and placed under the patient with the shiny side down. Next, the nurse puts on sterile gloves. The fenestrated sterile drape is unfolded and used to cover the patient's perineum.